tutorial in order to explain for the students, especially those who want to apply for the medicine and dental surgery, about the UCAT tests. So that's why I'm going to release this UCAT tutorial to everyone who wish to apply for the medicine or dental surgery, because you will just face with this UCAT test before starting your studies, especially to those who want to go in those faculties. So in my previous video, I have tried to explain for everyone structure about the structure of UCAT. I have just tried to explain each and everything. I think you have understood very well about the structure of the UCAT test. So now, and in my previous video, I have tried to talk about the timing, where you have seen that in these tests, what you have to consider mainly is about the time, because you have many questions and you have to answer all those questions within a very few minutes. For example, I've seen that in verbal reasoning, where you have about 46 questions, you have to ask all those questions in 20 minutes. Do you imagine? So in this case, you see that each question seems that it have about one, or it have about at least 20 or 20 seconds. So even in this abstractive reasoning, where we have 44 questions within 21 minutes. So here you see that each question may be having about 20 seconds, and it is a very I think that you should do in a very rapid way. So in this way, you have to do quickly so that you may get all the marks. And if you don't answer the question, you will get lost and you will lose the market. And I tried to explain you in my previous video about the situational judgment, where I have just showed you the topics, and I have just showed you the topic and tactics that you should do in order to answer all those questions correctly. So in this tutorial, I'm going to continue with the examples of the questions that are being used to be asked within the UCAT test. So in my previous video, I've just showed you the first example. We have tried to understand it very well. So now let me continue with the next video. With the next video, but with the second example, and I may continue with the another example as the time will be. So the second example, we have a scenario I have just tried to explain for you here, that in this test, you given the scenario, you have to read scenario very well. I've seen that in during the scenario reading, you just have to focus on what you should do. You should do, not what you will do. So you imagine on that time what I should do if I were in that case, so that you selected the right answer. Let us use that tactic to answer this question. So here we have a nurse ask a doctor Barnes to assist her with a patient consultation. The patient has become angry and is demanding to see a clinician. When Dr. Barnes and the nurse arrive at the patient's bed, the patient tells Dr. Barnes that he has been waiting a very long time, and the nurse has been rude and unhelpful. The nurse does not say anything. How appropriate are each of the following responses by Dr. Barnes? Here we are going to be given the answer that Dr. Barnes used, and you are going to select whether that answer is appropriate in within those two within those four options that you are given. So you will just select the right answer within these four, then you choose the correct. So you will choose whether this is appropriate or inappropriate. So let us listen to the answer. The answer is that how appropriate are each of the following responses by Dr. Barnes? The first answer is that the patient, the Dr. Barnes asked the patient to explain more about the nurse's behavior. So is this a very appropriate thing to do? Appropriate but not idle. Inappropriate but not harmful. A very inappropriate thing to do. So we are going to select. So to ask the patient to explain more about the nurse's behavior, you see, it is not a very inappropriate thing. So this last point should not be considered. You may just cancel it. This is the best way to answer those questions which are in this form of multiple choice, where you judge each option independently, as they have said as I have tried to explain it in our previous video. So to say this answer is inappropriate but not harmful, also it is not a correct answer. So it is not a correct answer. So we have just to eliminate this one too. This one should be also be eliminated. This this next point from below. So to say this answer is appropriate but not idle, this also it may just be correct, but you cannot get all marks. So here you will not consider this. Also you may cancel this one. So the last or the first point here from above, it is a very correct, it is only a correct answer. So the correct answer is this one. Is this one which is this one is this one which is above. This one is a correct answer. So this is the correct answer. Now you may go to the next, or let us understand why we choose that question. You see, for that one to choose that this asking the nurse, the person, for more information about the nurse's behavior, this is very important. It is a very important because Dr. Barnes, for the Dr. Barnes, he need to understand the patient's complaint so that he or she can manage the situation properly. Also, by asking the patient to explain further, this may prompt the nurse to contribute to the conversation. Additionally, Dr. Barnes is unsure whether the patient comments are fair. So, it is a best way to ask for more information for better clarification. Another addition is that when the nurse is listening to the to the compliance of the patient, he may get the time to involve within the conversation. So that's why this A that first point, which is very appropriate, should be a best or a correct answer. So this one will give you a full mark. You will just get a full mark during these tests when you choose this point, which is the first. And let me go to the next. So let us check the next example where they have said if the Dr. Ban asked the nurse to leave the patient's bedside, is it a very appropriate thing to do? Think twice. Appropriate but not idle. Think twice. Inappropriate but not harmful. Think twice. A very inappropriate thing. So here we may use just our tactic, that one which is to canceling the thing that you don't want to be involved in your choice. So to say that the to ask the nurse to leave the bedside immediately, it would not be a good choice. So this one you may cancel this. Let us cancel this. So to send the nurse outside, it is appropriate but not. It seems as if it is a light answer, but it is not because there is the term appropriate, and we know sending that nurse outside is not appropriate thing. So you may cancel these two. To say that it is inappropriate but not harmful seems as if there is some kind of meaningful for sending that one outside. So you may also cancel this one. And the correct answer is a very inappropriate thing because sending out that nurse, it will not correct the situation as you understanding the situation. So this will be in inappropriate. So the correct answer will be this one. Yeah, you see, guys, it is very easy, but all of those things we are doing in those minutes, you just have to do it, and you have just to train yourself to do it within a second so that you may get all or full marks. So the reason why you choose that this is inappropriate is that asking the nurse to leave implies that she has done something wrong at this moment in time. The fact the facts have not been established, and so it would be inappropriate to send her away. This would be more will be more appropriate if the nurse was demonstrating confrontational behavior toward the patient, but there is no there is no mention of this in the scenario. In the scenario, we didn't see that the nurse have just tried to to speak over the patient. So this shows that the nurse, he or she, was willing to explain herself or saying sorry for what she or he has done. So so telling her or him to leave the bedside would be an appropriate thing. So That's why we choose inappropriate. So the third answer for Dr. Ban is that after consulting Ban, ask the nurse how she feels about the interaction with the patient. So if you are the Dr. Ban and you ask the nurse to explain about the situation, do you think this would be an appropriate thing to do or appropriate